Yes, friends, welcome. After a very long time, today we resume the journey of making people feel better. Been a long time we've been online, but it's this topic that has been so much asked to be covered. I've said it's better that we cover the topic so that we can continue with our journey and see how everything is now. We fix some issues here. Yes, that way. Very nice, very nice, very nice. Long time we missed everyone, and see, it's good when plan some things. Okay, this one is coming up. Okay, good. Let's continue now. The topic of today, as per you've seen, is Olga Wilson. Welcome to the platform. Today we are talking about sexual health between women and men. Olga Wilson is the first one on the chat. We're going to give overview. This is a very big topic. It's a very big topic, but today I'm giving an outline of things that we are gonna go through, and it's very important that we check the outline. When we're talking about some issues, some things in life, like the topic of today, we are saying sexual health in men and women, uh, and even issues concerning fertility in men and women. This is related point blank and straight to organs that are the organs that are used for fertility and conception. You understand? Organs that we use to excrete. So it is very important we go through them so that we may understand, because issues that are related to sexual health are issues related to the tissues and organs that are destroyed. Now we go to, remember, this is an overview today, and I'll give some points before we finish. But from tomorrow and the other day, we will be dealing with the specific issues. But remember, if you have a question, you can put it up as we always do, so that we continue and we don't leave anyone else outside. Now, in men, what do we know about men sexual organs? We know we have the penis, organ for sexual intercourse and urination. That is the normal one. We know organs for sexual intercourse and urination. We have the scrotum. The scrotum, it is a sac holding the testis, regulates temperature also. You get it? The testis of a man uh, undergoes so many things. So it is outside the body to regulate the temperature. That's why your scrotum hangs out. And then we have internal organs of a man, whereby testis produces sperms and testosterone. Remember, testosterone is a hormone. These are things we will see step by step. And then we have something else here called the epididymis. It stores the premature sperms. The epididymis stores the mature sperms. And then we have the vas deferens. The vas deferens transports sperm. It's like a tube. It transports sperms. And then we have seminal vesicles, prostate gland, the one that every man at the age of 40s and 30s always talked about, the prostate. We will talk about the prostate at its particular time. It's a very big topic, and you'll see men usually fear when they hear about the prostate. Yeah? And then we have the bulbourethral glands. Those produces seminal fluids, the fluids that you produce when you are having sexual intercourse. You get it? You have the urethra, carries semen and urine. When you're having sexual intercourse, the semen passes through there, and urine also when you are urinating. Okay, we continue with the topic of today. We continue. We have several issues that come out when someone has a problem with these tissues and organs that I've said. The organs that I've named in a man, we have named the penis, we have named the scrotum. We've said the scrotum holds the testes and it regulates temperature so that your sperms can be well. You get it. Then we have the internal ones, which is the testis, epididymis, vas deferens, seminal vesicles, prostate glands, bulbotheral glands, and then we have urethra. You get it? All this. So there are some problems that men can encounter when these organs have a problem. Today we are going overview about them. We'll just rush about them so that we see. Next time we will be categorizing what to talk about, because you see something like the vast difference can produce a lot of problems in a man. Only one which transports sperms can make you be infertile. You get it? Plus other things that can come out. So today, the overview of common sexual health issues in men, you will find that we have erectile dysfunction, hmm, difficulty in achieving maintenance of erection. This is the number. We have started in men, then I go to a woman, yes. Because we all know the genders that we know God gave us is a man and a woman when it comes to siring kids and having those other issues. Now, we have erectile dysfunction. That one we will talk about when it is time. And erectile dysfunction, if you notice, it's a very big problem to men. It is a very big problem to men, and most men want to achieve the function, but they don't. But today we say we are giving an overview. Erectile dysfunction is the first one. ED, we always call it ED, premature and delayed ejection. So premature is uh, you eject so early the sperms, you understand, and then we have delayed. You stay for so long without ejaculation for men. You get it? And then we have infertility issues in men. Now, what do we talk about infertility issues? When we talk about infertility issues, what do we understand? Infertility issues means you have low sperm count. Sometimes, when your sperms are, you release the sperms, they have to be motile, they have to move, they flow. So when you release them, they can be slow in motion, or they cannot have that capacity to flow so that they can penetrate in. And sometimes that I've just said, blocked ducts can make you to be infertile. So the main causes in men that may make the men to be infertile are low sperm count, poor sperm motility, and also blocked duct, like the vas deferens, which transports sperms. If it is blocked, your sperms can't get to where they're supposed to be so that they can fuse. Right there? Yes, you understand? Infections, very important. This is something that we will talk about. Infections in men can totally destroy a man to be infertile. You get it? But there are other infections that can make you not to be infertile, but they'll destroy your organs. You get it? Chlamydia, gonorrhea, syphilis, HIV, HPV. HPV is a virus, and herpes. We will talk about HPV, HIV. One of the videos we talked about the HPV virus and herpes. You see, those are viruses, but the sexually transmitted disease that we commonly know, there is a difference between sexually transmitted infection and urinary tract infection. So sexually transmitted infection are like syphilis, gonorrhea, you get it, herpes, those ones that can be transmitted sexually. Although in other way, urinary tract infection can also be transported sexually to your partner. And then in men, we have another problem we call prostate problems. You see, prostate comes specifically on its own. It's a very small gland, but a very big gland in terms of what it does to a life of a man. You understand? Now, we go to prostatitis. Prostatitis is infection of the prostate. And then there is a difference between prostatitis and prostate hyperplasia. We have hyperplasia and prostatitis. Prostatitis is infection, but hyperplasia, that is a form of cancer. You get it? Benign prostate hyperplasia is, when I say benign, is local. It means the tumor or the cancer is local. The tumor is at a specific place, locally at a specific place. You get it? But when I talk about it is malignant, I'm saying that one is spreading. So you differentiate when I'm saying benign prostate hyperplasia and prostate cancer. No, benign is at a particular place, let's say in the prostate itself. But when we talk about prostate cancer, we are talking about malignancy. It is spreading through the pelvic region, the pelvic region. As we continue, as you're watching wherever you are, if you have a question, please post it on the chat so that we can help you catch up with us. Now, we've said about the prostate problems. That one is a big topic. It will take like 2 days to finish. We have prostatitis, which is infection, and then we have benign prostate hyperplasia, the hyperplasia, which is the cancer, or the benign, which is local. Local, it is situated at the level of the prostate and it is not spreading. The prostate swells. The cells of the prostate swells. When you hear about hyperplasia, the cells of the prostate swell. You get it? And then we have prostate cancer. This one can be a form of malignancy. When I'm saying malignancy, it means a form of spreading cancer. The cancer is spreading. You get it? It's very, yes, finally I saw you from Team Marwa. Lucy Ndulu, welcome. Today we are talking about sexual health in both men and women, and women. Now, we have said about the prostate problems. Now, testicular condition, testicles when some, let me give you an example. When people have boys, they sire boys, sometimes they go to hospitals and they are told your boy's testicles are not coming down. The testicle can be a problem. Now, I usually say if you have a private question, let me pin my email address that we use, benjaokwesh@yahoo.com. Yes, we use that one. If you have a private question, you post it on that email address, and within 24 hours, you will be given way out. You pin on that. Today, we are talking about sexual problems in men and women. Now, in the testicular conditions, we have torsion, varicose, and then we have hydrocele and testicular cancer. We will see how these things are. What is a torsion? What is a varicocele? What is a hydrocele? Hydro means water. Also, cele means what? A pouch. Yes. Testicular cancer. You see, those torsion means strangulation. Sometimes the testicle can be strangulated. And then when it is strangulated, what happens? It starts to die off. You get it? Now, another thing in men that can be a very big problem is hypogonadism. Hypogonad, I mean you are a man, but the hormones that you have as a man are low. So you start behaving like a woman. Hypogonadism. You have a voice of a woman, your testosterone levels are down, you have reduced libido and muscle loss, fatigue. You get it? Those are problems that men face. Sometimes when you have hypogonadism, low testosterone, you may not have the libido to satisfy someone or you yourself. You get it? So these are things that can be helped in terms of medical adherence. So we continue. Those who are we were talking about common sexual health issues. Those are common sexual health issues when it comes to men. I'll repeat the topics that we will go through. These are erectile dysfunction, ED, premature and delayed. Hey, Wambo is here. Hey, Wambo, welcome to the room. We're talking about sexual health in both men and women, and these are the outline of these problems. Now, erectile dysfunction, there is premature ejaculation. This is common sexual health in men. Infertility, we have said low sperm count, poor sperm motility, and blocked ducts. And then we have infertility, that one we've seen. Infections like chlamydia, gonorrhea, syphilis, HIV, HPV, herpes, those ones happens in both men and women. But here we have another thing for men called prostate problems. That is specifically for men because women don't have prostate. So what happens in the prostate is this: prostatitis, infection in the prostate, benign prostatic hyperplasia. You have talked about it, a form of cancer, but within the prostate. And then we have malignancy that is called prostate cancer. These are outlines that we're going step by step. Today we are outlining whatever we will be going through. We have testicular torsion. Testicular torsion, mostly this happens in kids. Kids, if you get a boy, check the testicles. Are they coming down? For the young people that are siring kids. Torsion, we have varicocele, we have hydrocele, we have testicular cancers. You get it, all those we will learn. We have low testosterone, hypogonadism. I've said hypogonadism in men is low testosterone. When you are a man, but you have characters of a woman, low libido, muscle loss, and tone. You get it. We will talk about it. And if you have simple English for me from Gitu, Gitu. Yes, Wambo. If you have a question and you have not understood, please just pin it. I'll paraphrase. Yes, I'll paraphrase. Now, like low testosterone, hypogonadism, I've said, hypogonadism is low hormones. A man, the hormones of a man are in low production. You get it. So if you don't understand anything, there is a chance to expound. So just pin it on the medical terms sometimes can be confusing even to medical practitioners. So when we help each other, we understand more. So if you don't understand anything, don't be afraid of asking, just ask. These medical terms are confusing. Now we have dealt with the man. That is an overview of common problems that a man can undergo at an age of siring kids. And we go to sexual health in women. In women. Now, I've said when we talk about sexual health, there are tissues and organs that are destroyed or are affected. So, in a woman, which are these organs? These organs are external organs. At the vagina, we have the vulva. The vulva is the opening. We have the labia and minora, protect genital structures. You see, the labia and minora are the lips, the labs that protect the inside. Sometimes that or some issues like bacteria cannot go in. We have the clitoris. The clitoris is the primary organ of sexual pleasure. And then everyone knows the protruding thing is the clitoris. We have the vagina opening. Very important. That is a very important thing in life. Without it, no siring kids. Now we have the internal organs. The internal organs of a woman, of a sexual health in woman, is the vagina, which receives the penis. It is the birth canal, and it removes the menstrual flow. You get it? The vagina. Its work: receiving penis, birth canal, and removes the menstrual flow. And then we have the cervix. The cervix is the opening inside. After the tract of the vagina, you have the cervix inside. It's another opening to the uterus. You get it? Where your kid is. Your kid grows before comes to this world. lower part of the uterus is called the cervix. This is a very important thing. The cervix is a very important thing when it comes to sexual health and a woman's health. Not that it is just an opening, but it's a very important opening of life. We will see why the cervix is very important. Where here it is the passage for the sperms and the menstrual flow. You get it? It's just that passage, but you see, when we continue. Yes, yes, yes. We are giving Wambo, we are giving an overview. The diagrams are coming when we are breaking down. We have just started a very long topic. So don't worry about this. Just listen, and then the diagrams will be projected. If we reach at a point where we are discussing the cervix, we'll be seeing the cervix itself. So don't worry about it. But I have another picture here. Let me see. This is a woman's uterus. Look at that. Look at that. The cervix, myometrium, yes, the uterus. You see? And then we have the vagina down here, the vagina. Very important. Don't worry about it. A clear picture is coming very soon. It will be projected as we go on. Now, we continue to the uterus. Houses developing fetus, where our kids lay as they wait to come to this world. They grow there. Yes, we have another one, the fallopian tube. The fallopian tube transports eggs from the ovaries. The fallopian tube transports eggs from the ovaries, site of fertilization. So when your sperm has flowed and has gone inside, they fuse at the fallopian tube, because this I think this one is an important one. Let me put it here. When you release some eggs here and they flow, fertilization happens here. Here is where fertilization happens at the fallopian tube before they come here. You get it? Before they come here to start a new life. You get it? So we go on and learn these things. They are very important. We are learning these organs because they are the organs that bring us problems when we talk about sexual health. Now, we continue. I see Karen White. Karen White, welcome to the platform. As per the topic you've seen, the topic we are talking today is sexual health in both men and women. And you have seen, people think it's a small issue. Yes, it is a very big issue in the society, and it should be taken with seriousness. With seriousness. Now, we are here talking about the fallopian tubes where fertilization takes place. And then we have ovaries. Ovaries, you've seen where the ovaries are. Ovaries, where are your ovaries? What is in the ovaries? What is in the ovaries is what is called eggs, the ova. Wambo has told me to a diagram. Now, a diagram is this one. At least we have one diagram. Marcia Thompson, hello, welcome, morning. We're talking about sexual health. Now, this one, the ovary is here, produces the eggs and hormones. This thing called the ovary does not produce eggs alone. It produces hormones. It produces hormones such as what? Estrogen and progesterone. And you see, estrogen and progesterone are the main hormones when a person wants to be fertile or infertile. When you go to a gynecologist and you have not been conceiving for so long, the gynecologist will take your blood and will send to the laboratory. They will ask for estrogen, progesterone levels so that they can know which state are you after menstrual period. Is it the hormonal imbalance that is making you be infertile? Yes, we will see how hormones can make someone be infertile. Roger Keeler in the house, Marcia Thompson. Roger Keeler, welcome, welcome, welcome. If you're not understanding anything I've said, medical terms at times can be so confusing and frustrating. Don't be shy asking, just ask. Ask. Today we are talking about sexual health in males and females. And we are going through the organs of sexual health. Why? Because they are the ones which are affected. How dangerous is it to abstain? Abstaining is not dangerous. In fact, I feel abstaining at times may be better for both male and women. You see, abstaining, but you have Wambo has asked about abstaining. Which what abstaining from what? Wambo, please paraphrase. From what? Yeah, there are so many types of abstaining. Hmm? Eh, Someone is asking if you're married. Yes, yes, yes. Abstaining from sexual act or abstaining from what? Wambo, please tell us. Now we continue and let's use English. Most of the people in the chat are not from Kenya. At times, we need to understand each other and share the fun too. Now we continue. We've talked about ovaries. Those are the major organs of a woman that may be disturbed for you to bring problems in sexual act. Now, for a woman, we have said labia majora and minora, which protects the genital structure, the clitoris, primary organ of sexual, and then we have sexual pleasure, and then we have vaginal opening. Then we have the internal organs in a woman, which is vagina. The work of vagina is to receive the penis, it's the birth canal, and it removes the menstrual flow. We have the cervix, lower part of the uterus, patches of sperm, menstrual flow. We have the uterus, the uterus houses the fetus. After implantation, we have fallopian tubes where transport of eggs and ovaries happen, and then we have ovaries. Ovaries produces eggs. Now, for a man, we go back to a man before we go to common sexual health issues in a woman. So, for a man, we talked about, just a review, the penis, the scrotum, the testis, epididymis, the vas deferens, and then seminal vesicles, and then the urethra. The urethra. Now, we see common sexual health issues in a woman. What are these common sexual issues in a woman? What are these? We have menstrual problems. Menstrual problems in a woman is a very complicated and disturbing at times. I know women who are in here know this. Sometimes you have friends that are undergoing this. This one, we talked about, we have a video where we talked about this, and you can go, but we dealt with it and in a manner that we were talking about how it affects your mental issues. But now, the next one, we are going to talk about it, about the physical disturbance, how it happens and how it can be helped. We have dysmenorrhea. Dysmenorrhea is pain in menstruation. When you hear a doctor writing dysmenorrhea, just know this is pain in menstruation. This pain in menstruation at times is not good. Pain in menstruation, it makes women go bad. So if you are a man and you have a woman in the house and you feel this woman is in this state, please be caring, support this woman at times. And then we have menorrhagia. Menorrhagia. This is heavy bleeding. Some people really bleed when they are in menses. At times, even the HB, the hemoglobin levels go down. We will see why and how we can regulate it. And then we have irregular cycles. After 1 week, you've started menstruation again. You get it? It is sometimes not good. It's frustrating at times. You stay, and then after 1 week, you are menstruating. Just imagine that is not good. We will see how we can help these women to come back to normal life and at times even to be okay. We have infertility in women. Infertility. You see, what the women share in infertility, there are some things women share with men, like blocked tubes, and low eggs. For men, it is sperm count. For women, it is eggs. You don't produce the ovum. You check it. Blocked tubes, ovulation disorders. Hmm? When you've just had a sexual act, you are menstruating, so you cannot implant. You see, ovulation disorders. We have things like endometriosis. Now, there is a confusion that of these words of endometriosis and endometritis. We will expound what endometriosis is and endometritis is. For now, was advised to be taking Zulu MR for that. Now, Wambo, Zulu MR is called a prostaglandin inhibitor. It has got Zulu is aceclofenac, paracetamol mixed with a methotrexate. So the more you take a cyclophenol, you know they have other problems that they can do in your body. But we will know how to help this when it is. You see, Wambo is saying is taking only painkillers, but not helping when it comes to helping yourself to have a long time solution. We will see, Wambo, don't worry. Actually, I took it this morning. Sorry about the pain, Wambo. You will be okay. Now we are talking about ovulation disorders and then endometriosis, and then we have polycystic ovarian syndrome. Polycystic ovarian syndromes. Beauty in the house. My good friend Beauty has arrived. Thank you so much for coming to the platform. We are talking about sexual health in both men and women, and we are giving an overview. You get it? Now, polycystic, if you have had a cyst, let me expand on this before we continue. A cyst is something called a pouch with fluid inside. So, poly means a lot, ovary means the ovary. So here we talked about polycystic ovarian syndrome. It is cysts accumulating in the ovary, several cysts accumulating in the ovary. We will see how it is related. You see, this is a big topic that we will not finish even in a month. But because of people asking and asking about this and also texting for more, it is good we bring it out so that people can know how wherever you are you can go to a doctor and you will know what the doctor will help you and how you can carry this out. We have infections like STIs, UTIs. For women, you are prone to yeast infections. Some of the women are prone to yeast infections when they take antibiotics, and sometimes when they do what? Not antibiotics alone. When they take some other foods, we will see why yeast infections. And then we have bacterial vaginosis. The opening of a woman is not like of a man. So more bacteria are prone there to take some proteins. You get it? So we continue. Chlamydia, gonorrhea, syphilis, hepatitis, HIV, and herpes. Now, sexually transmitted infections are there. And then we have PID, pelvic inflammatory disease, infection of the pelvic region. You see, the pelvic is a big organ. The pelvic is a big organ like this. So in the pelvic, you have so many things. You have lymph nodes, you have muscles, you have tendons, you have, so you get it. So when you get an infection and then it spreads to the pelvic, you may be dealing with a very big problem. So when we talk about PID is a painful thing. Starting, it sometimes ends up to the uterus from the cervix. And you see, the cervix is a part of a topic that we will do it in one day alone. The cervix. You understand? Yes. We have some cancers, cervical cancers, ovarian, uterine, and vaginal. Remember, we have the vulva. Now, the cancers. You see how the cervix is an important thing? It's just an opening, but a very important. It has a significance in the life of a woman. An opening that is very important in the life of a woman. We will see why. Now, we have sexual dysfunctions in a woman too. It's not only men that have low libido, no. Even women have low libido, vaginal dryness. That is common to some people, but it's a problem. You get it? Hmm? And then we have something called painful intercourse. Painful intercourse, like dyspareunia. Hmm? Very complicated words, yes? Very complicated. So if you don't get them, just ask. Dyspareunia is a painful intercourse, or vaginismus. You get it? These are things that we will learn step by step. We will be picking one topic from a man, the other one from a woman in one day, and then we continue. And then we have the common one, which is menopause related changes. Menopause related changes, those are common and they disturb. Menopause, that is a big topic. Hot flashes, you see those, decreased estrogen, vaginal atrophy. Atrophy means hypertrophy, means being big. Atrophy, small. So when you get to menopause, your your vagina becomes small, small. You see, it's a problem. We will see how it's a problem and the hormonal changes that are encountered within this. We have other shared concern in both men and women, like sexually transmitted infections. We have contraceptions and family planning. This is a big topic to married couples. Those that women don't want to take pills, they tell the woman, I'm tired of these pills. You can do vasectomy. A man says, I'm an African man. Um, sorry, Mercy, about that. I understand. Yes, yes, yes. We are just listening. Yes. Or you see, when family planning gets to be a problem in a family, it is a big problem because someone will say, you see, for African men, they don't like vasectomy. But a woman again will not want to be taking pills always and getting injections. So what do we do? What do we do? This is a problem that needs to be sorted. Sexual, we will know about family planning and contraceptions when it comes, so that we can help families that are fighting between you do it, me do no, me I don't want, you do it, and then a family breaks. No, sexually transmitted infections can be avoided. It's very important by doing what? By avoiding and using the proper mechanisms. You get it? Faithfulness is very important when it comes to sexually transmitted infections. It's very important. So here, it's a topic that will talk about the social life and very many things and how to avoid some issues. And then we have psychological issues like stress, depression, performance anxiety. These ones we talked about in mental health. What about condoms? Are they safe in marriage? Can it help? Yes, condoms are safe in marriages. They can help. But you see, when you receive a client and then it tells you, you tell a client, a married couple, to use a condom, they start asking you, will we be using a condom daily? Will we buy boxes of condom and put them in my? You see, but if you have the discipline of doing that, it is a good one. It's a good one. I really don't understand why some people say I don't love condoms. It is their own opinion for not using it. But you see, it is the safest way of avoiding so many things like STIs. The problem becomes when it is put in our head. When someone is thinking about a condom, he's thinking about avoiding HIV, not pregnancy. It has been a culture that when you are using a condom, you are not, you don't want to get HIV. You see, that culture has made marriages not to be stable and not to use condoms. But condoms are safe, the safest everywhere for both men and women. Yes, especially in Africa, it's a problem. And it is for men. Men are the problem when it comes to condoms. They say, I cannot use a condom and you are my woman. It's a bad thing. But there are some women again that are allergic to condoms, plastic. There are some women that are allergic to plastic. So at times we may listen to them, but there are some women again that may lie they are allergic to condoms because they don't love using condoms. So we will talk about it when time comes. This is a topic that we need to discuss, and the women in the house will help us to understand again, even the men in the house. The problem with men, we don't like coming out and saying the truth when it comes to issues like these ones. But nowadays, people are coming out. Like, let me give you an example of one day in my facility, there was a free screening for free screening for prostate hyperplasia and cervical cancers. We saw more women. We saw more women and one man. A man who came to do a PSA and more women who came for cervical screening. You understand? Now this is Africa, and I'm sure not Africa alone. Even outside there, it's like that. Now we continue. We were on stress, depression, and performance anxiety. Now we go to body image and self-esteem. This one is a problem of mental health. We will deal with it in mental health perspective. Body image and self-esteem. When you are forced to marry someone you don't like because of the physique, you get it. It becomes a problem. And then we go to sexual orientation and identity concern. This is something that people don't like talking about because of the wars that are going on between the LGBTQ and the cross gender. But us, we will deal with it medically. If we will deal with it medically and we see the how we can help people to revive to true identity and gender. You get it? Because when it comes to science, we only know science only knows of two genders, female and a male, and mutation, which is the hermaphrodite. That is the third one. This is about science. Let's talk about science. We switch off the lights. Hey, Wambo is something else. Eh? Wambo is a funny guy. Now we continue. We continue. Age-related changes. Yes. Hmm? Age-related. When you get old, your fertility reduces, hormones shift, and then the libido comes down. And you see that is the time you've taken your children to school, they are independent, you are there with your man, and you are just two, and the libido is down. We will see how we can help to revive these things. You get it? So that when your children have gone, you are not so down, you two plus your person. Now, we have talked, that is the overview of sexual related issues. We will start with sexual related issues. Yes, I've been asked about the diagrams, they are coming, we will be projecting them, and it is very important that we come up with this session of today. If anyone has a point before I go, you can put it out. We have talked about sexual health in men. We have seen the organs like penis, scrotum, testis, epididymis, vas difference. On body changes, it's true. On body changes, it's true it can be affected sex life. So switch off the lights, problem solved. So Wambo has told you that. Wambo has told you on body changes, don't reason. Just switch off the lights and everything is good. Hey, Wambo. Now we continue. We've talked about the testis, epididymis, vas deferens, seminal vesicles, and urethra. We have seen the common problems: erectile dysfunction, premature or delayed ejaculation, infertility, infections, prostate problems, testicular conditions, low testosterone, hypogonadism. Now, in women, we have gone through labia minora, clitoris, vagina, and then we have we have vagina, the internal organs, cervix, uterus, fallopian tube, ovaries. And then now the common sexual issues in women, we have seen menstrual problems, infertility, and infections, pelvic inflammatory disease, cancers, sexual dysfunctions, menopause related changes. And then we have the shared between men and women, which are sexually transmitted diseases, contraceptions, and family planning, psychological issues, body image and esteem, sexual orientation and identities, concerns, and age related. Now, from tomorrow, you'll be having the diagrams. We will start with dealing with one problem plus the organs themselves. We will expand on the organs so that we can know what organ does what. Because we have just named them, we need to know deeply. If we go deeply, we will know why someone behaves like this, why someone cannot ejaculate, and why the libido is down. Yes, today has been a good day after a long time of not coming online. We have been up and down work, meeting friends, doing ABCD, and today I've met my friends like Wambo, Karen White, Beauty, Marcia Thompson. Sorry for what you are undergoing. It will be sorted soon. I know we talked, and then we are there more. Roger Killer, wherever they are. Today I've met Lucy Ndulu in the platform. The email address is attached. If you have any question concerning anything about the topics that we are going on with, you can email to that one. If you want it to be addressed confidentially, without coming online, without naming you, say it to that email. You get it? If you want it to be an open or discussion, put it, say open discussion. You get it? Because we value your privacy. So if it is private, put it private. If it is open, just say let's put it open so that I get help from the platform. So thank you so much on everyone who has logged in with the likes. Continue sharing. I'm seeing some people have followed and followed and followed. The platform is coming up to be at 1,000, and it's a good step we are making. It's a good step we are making. So I usually give 2 minutes if there is any question. If there is any question, so that as I am live, I can tackle it. So anyone who has a question can put it right now before I log off. It is 5:10. I have 10 minutes. I have 10 minutes. I have 10 minutes to attend to something else. So this is the time for any question that will pop out. This is the time for any question that will pop out. I asked about abstain. Yes. Uh, you see, abstaining Wambo is a good thing when you and your partner have decided. Or if you are single, you don't have a partner, you abstain so that you cannot move around to get. You see, the factors that are involved in moving around and sleeping around are so many, you can get so many problems. So abstaining is the better option for every gender. Abstaining is the better option. You wait when it is necessary to have a sexual partner so that you can have sex with. And you see, you let's talk about sexual health in both genders, men and women. Am I safe from cervical cancer or exposed to cancer? Wambo, that is a very important question when it comes to cancer and cervical cancer. Your state of getting cancer has so many factors related to it, like genetic factor, sanitation, you get it, and other things like what you do in life. Exposure to some, there are some family genetic line that don't get cervical cancer because they don't have the factor in their life. You get it? Exposure to random sex can lead you to be closer to getting cervical cancer because the more you round around and you get HPV virus, you see HPV, human papilloma virus, so it has nothing to do with abstaining. It is 50-50 about it, Wambo. It is 50-50 because let me say you have abstained having sex, but your sanitation is poor, and then you get a UTI or you get HPV, you can end up having cervical cancer. If you are genetic line, you have that. You get it. So abstaining is better because if you don't abstain, you are more close of getting cervical cancer. The topic of cervical cancer is coming, and you will learn more about cervical cancer. You get it. So for me, I would say abstaining is better until you get one partner that you have that is faithful because it keeps you from away from getting cervical cancer. But that topic is coming in broad based. Don't worry, we'll talk about it. Wambo, don't worry about it. Now, I think my time is up. If there is no any other question, we will meet next time as we start the journey of sexual health in men and women. Today it was an overview. Be blessed, everyone, wherever you are. Have a nice day.